Good afternoon. This is Juan Cotto, and I am a broadcaster here on Rainier Avenue Radio World, your community radio station, and our regular Friday series, Impacts of the Coronavirus. And today we have Margaret Cary. She is a child psychologist, and she is at the King County Department of Community and Human Services. She also co-chairs the American Academy of Child and Adolescent Psychiatry Family Committee and the Resource Group for Youth at the Borders. So I wanted to welcome you to Rainier Avenue Radio today.
Thank you so much for inviting me. It's a pleasure to be here.
Thank you very much for being on our community radio station. Tell us about your role and what you do at the King County Department of Community and Human Services.
Well, as you mentioned, I am the child and adolescent psychiatrist at King County, and my role at King County there is a policy role. And so I am a thought partner with many of our initiatives across the country to advocate for the well-being of families, youth, and young people, and particularly advocating for their emotional health and well-being.
Tell us about what has been the impact of COVID-19 on community mental health.
Well, I think that one of the biggest recognitions of COVID-19 is that it has exacerbated stresses that were pre-existing within our community, and it has just added one more layer of stress. And the impacts of COVID-19 have varied over the course of this pandemic, as they can with many pandemics. Is in the early stages of the pandemic, when we were just starting to learn about it, community members rallied and they rooted into their strength and their resilience. They came together, and I think we all just dug in to get through it. This is hard and it's long. And so as this has worn on, as we've had to carry more and more uncertainty about how it will impact our finances, our schools, our plans, our caregiving, what we will have resources for, what our family members and our community members are holding on to, along with the grief and the distance, not being able to hug people, not being able to gather, all of those things, not being able to do all of those things that we had become accustomed to relieve our stress, to experience joy, to take care of ourselves, across all aspects of our life, from our spirituality to how we celebrate, how we go through holidays. This has worn on all of us, and what we have seen from surveys that have been done across the state and here locally in the King County region is that increasingly people are reporting feeling anxious, worried, uncertain, depressed, stressed in general. And that's a big deal, particularly for individuals who are coming into this pandemic already holding a lot.
I am Juan Cotto, and I'm a regular voice here on Rainier Avenue Radio World. You've probably seen me broadcast high school football games, telling the stories of kids in our community. And unfortunately, we haven't been able to tell those stories this fall because of the absence of sports and so forth. But I'm here with Margaret Cary, and she is a child psychologist, and she is with the King County Department of Community and Human Services. Margaret, tell us about the types of services that are available from King County Department of Health for mental health.
So our behavioral health system, which King County partners with, is doing incredibly innovative things to increase access to behavioral health services for individuals who want to engage in what I'd call the formal behavioral health services, or traditional behavioral, probably actually not traditional behavioral health services. We know that people have been taking care of their emotional health in a lot of different ways, but organizations have figured out how to make telehealth accessible. They figured out how to partner with organizations and with communities to give laptops available to agencies and families so that they can access telehealth. A lot of what we have seen that was necessary in the early stages of the pandemic is that clinics closed to in-person care in service of reducing infection risk. And so a lot of the services and supports and treatment that people had been receiving, youth, adults, which had been in person, had to switch to telehealth. And so there's been a whole lot of work. And we know that some people who had never accessed behavioral health services before have now been able to access them because you don't need to drive all over town to reach them. and in a way, the resources have been more available to some people. For other people, unfortunately, we know it's been harder because of lack of internet access, or lack of ability to find a safe place where they could really talk about what was going on because of their living circumstances or whatnot. So in addition to bolstering and innovating across the kind of formal behavioral health system, there's been also a whole lot of work to increase the word and talk about our emotional health and well-being, how we're doing outside of that, just around community. There have been surveys that have gone on. A group of youth connected with the Reconnect Opportunity Program did a survey of youth predominantly in South King County, just checking in about the impacts of COVID on their mental health as well as academic and other goals in their life. Another group of students out in Skyline did a similar survey. I think other organizations are reaching out to their community members. We're increasing something called mental health first aid, which is kind of like CPR, except for folks who are in emotional or behavioral health crises. And it is a way to increase awareness, reduce stigma, and increase the capacity and competency of us community members to act and support when we see somebody we know, or somebody maybe that is a community member that we don't know as well, and just check in and make sure that folks have access to the services they need. So I think that King County is working on both formal and informal ways to increase behavioral health supports. We've also done some mental health fairs in partnership with NAACP of King County and Disability Rights Washington, again, to get information out to communities to know that you're not alone. There are reasons to be stressed. There are reasons to be distressed right now. It's not obviously a failure or a weakness, but these are hard times. And so let's talk about it and support each other.
Is there still a stigma attached to mental health and conversations about mental health in our society?
Well, as a clinician, as somebody who's obviously likes work and passion is this, absolutely. And I think it differs in different groups, and I really commend a lot of groups of people, and young people in particular, for speaking up about it. And I think having courage to enter these conversations with extreme bravery, and they are, as youth always are, models and inspirations for us older folks.
Mm-hmm.
But I think stigma varies differently across generations and across different communities.
You are with Juan Cotto, Rainier Avenue Radio.world, your community radio station, our community radio station. I have Margaret Cary, who is a child psychologist, and she is with the King County Department of Community and Human Services. And she's talking about different programs available in regards to this whole COVID-19 and impacts of the coronavirus and impacts of the coronavirus on mental health. Margaret, youth suicide rates in the United States are on the rise. They've been on the rise for a while. What are some of the factors leading to this trend?
I think that is something on everybody's mind, and not only are they on the rise nationally, but they're on the rise here in King County. There's been an 80% increase in youth suicide over the last 10 years. This is heartbreaking. This is tragic, and this is hugely problematic. And people are really trying to figure out the reasons why, and we're trying to figure out locally the reasons why. And there are, not surprisingly, a whole lot of factors. Some of the factors I think that people are concerned about is general stress and awareness. I think people are concerned about the impacts of racism, white supremacy, the political system, climate change. People are concerned about kind of the pluses and the minuses of social media. Social media and internet connection has increased connectivity of youth around the world in ways that have helped youth build communities in incredibly positive ways and help youth rally to advocate. At the same time, bullying and cyberbullying can now happen 24 hours a day, 7 days a week. It's not just limited to when you're at school. And I think that parents are working a lot, caregivers are working a lot. And so some of the connections that families have been able to have with their kids is been more strained.
How well do we understand the behavior in youth which signals suicide risk?
We know what we know, and we don't know what we don't know. And to be quite honest, the research really lacks in what are the most predictive factors that will help us know when somebody is feeling distressed, or somebody may be thinking that their life isn't worth living, or that their life is too much to bear. And those factors that will predict who is going to act on those thoughts. What we know is that suicide is oftentimes an extreme solution to feeling extreme distress, but it is but one solution. And so as we help engage youth in thinking about other solutions to handle their distress, we can help increase the options that they feel that they have. There are a lot of gaps in suicide research. And frankly, there's a lot of gaps when we start looking deeper into cultural factors that impact suicide. And I think that's where this field really is aiming to go. You know, at the same time, there's definitely some warning signs that we know about. When youth start isolating, when youth start doing things that are very uncharacteristic, not hanging out with friends, having trouble engaging in the activities that they used to love, losing their joy, not laughing, not joking, these things that are typical, frankly, of all youth. And I think oftentimes we see that. And the other thing that I hear over and over and over again from families, as I still have a clinical practice and I do a lot of clinical work in community, is families and loved ones often say, I had no idea that this was coming. And so as well as we know the young people in our lives, youth are also incredibly skilled at putting on masks. And I think that this raises the importance of asking, and not being afraid to ask about suicide. We know what we know very well about the research is asking about suicide doesn't put the ideas into their heads. It actually helps them feel understood.
Like you said about masks, there's a lot of adults that can do that too as well. Juan, Cotto, and Margaret Cary, a child psychologist who is at the King County Department of Community and Human Services, on your community radio station, our community radio station, Rainier Avenue Radio.world. Happy Friday, impacts of the coronavirus. And you touched on it a little bit, race and socioeconomic status. Tell us about the factors that we're seeing in regards to mental health in the lower income and also communities of color.
Absolutely. So not surprisingly, the more that we have to hold and the more we have to bear, the more stressed we are. And we know that communities and families that are dealing with more financial insecurity and economic insecurity are holding a lot more stress. We know that families and individuals that are most impacted by racism and white supremacy are holding on to daily stresses. And so you add the uncertainty of COVID and all of its ramifications for the disruptions to our lives and our routines and our resources and our outlets. We are seeing quite clearly in our local data how that is manifesting in increased anxiety and depression. So for example, at this point, about 40% of adults in the Seattle, Bellevue, and Tacoma metropolitan areas are reporting feeling anxious most days of the week. But almost 50% of the multiracial respondents are reporting feeling anxious. About 30% of the adults in the same region are reporting feeling depressed more days than not. And almost 50% of the Black and African American respondents are reporting feeling depressed. Also, again, those, as you mentioned, those who have more financial insecurity, those who have lost jobs or anticipate losing jobs, those who have less formal education, those who are living alone, those who are feeling more lonely and isolated, have higher rates of depression and anxiety, which then just is another factor to contend with everything else that we and they are juggling.
Margaret, how can we, as adults, and I have two children, but as parents and guardians and folks who are taking care of kids and taking care of ourselves with stresses that we have in regards to finances and so forth, how can we take care of ourselves and our children in such an extraordinary time?
There are three general takeaways from the research and the science and the observations from across the world and from across time and from across cultures about some of the core ways that we can take care of ourselves. And this obviously is grounded in one, we don't need another to-do list. We all, as you clearly outlined, have far too many to-do lists. And those of us who are parents and trying to work are now having to be teachers as well. And, thank heavens for the teachers. They are struggling and rising to this occasion with aplomb. But part of these takeaways are we don't need another to-do list. Don't do things that are going to increase your stress. Do things that are going to help decrease and help ground and root and calm you. The second thing is that self-care is not all up to the individual. Self-care is really on our systems and our communities, right? Healing exists in our communities and in our families. And so we also really need to rally, not sort of in this notion of what do I need to do as an individual, but push back on our systems and our institutions and our communities to create the spaces to help us do these three things. One is check into ourselves and check into others. We can't really address what's going on until we accurately and authentically define what it is. So again, how am I really feeling? Check into the others, check in with others that we love. Ask about suicidal ideation. If we don't know, we can't do anything about it. The second thing is to connect with ourselves, connect with others, but also to connect with our values, our purpose, our reasons why, our faith, our gratitude, our joy. And as we build those muscles, just like any coach, as you build your optimism and your excitement, it will be easier to draw on and act from those places. So in addition to checking in with yourself and others, connecting to others, reaching out, giving help, giving resources, giving support, connecting with your values and your purpose, the last is to take care. Take care of your mind, your body, your spirit, your emotions, and your people, your community, your family. Sleep, I can't overestimate how important sleep is. And I appreciate that the more stressed we are, the harder it is. So as you can and be kind, try to get sleep. Be outside. I think all of us are grateful for the rain after all of the smoke. So enjoy it because we got it right now. Move your body, exercise, dance, stretch, eat healthfully as you can. And then stick to routines that are helpful for you. Those routines can really provide organization, calm, predictability in these unpredictable times.
You're listening to Juan Cotto and Margaret Cary. She's a child psychologist for the King County Department of Community and Human Services, and just creates some great ideas in terms of taking care of oneself during this extraordinary period. We're on Rainier Avenue Radio.world. This is our Friday afternoon special called Impacts of the Coronavirus. Let me ask you this question: with schools just starting up within the last month, what have been the impacts of schools on the children, and how? And you mentioned a little bit in regards to the online classes and the lack of connection with your students and your friends, and also how are the teachers? We heard the reports of how the teachers are adapting to this whole new environment.
Absolutely. Such a big and broad question. And I would like to first give respect and a shout out to the Opportunity Youth COVID-19 survey that was co-sponsored by CCER and the Community Center for Education Results, King County, and SOAR, who again surveyed over 200 young people throughout King County about the impacts of COVID-19. And they have some really interesting results about the impact not only on our mental health, but also on school and online studying. And one of the things that was a real takeaway for me was the youth calling out that online learning works a lot better if you have a relationship with your teacher. We know that learning happens in the context of trusted relationships. And I think that this is something that families and teachers and school staff and school counselors are all highly concerned about, because it's so much harder to form that relationship online. And so that is one of the major impacts, is how do we really build that relationship and that trust and that sense of connection that allows our brains and our bodies to be calm enough to absorb information, but also allows the adults in our lives who care about us to check in and notice when something's going on. And I think that that's something that's giving, from what I've heard from colleagues at Puget Sound Educational Service District, that's something that's giving school staff and teachers a lot of stress, is how do I support these students? How do I totally change my teaching? How do I ensure that students are engaged and motivated and excited about learning in this dynamic that is more distant? Parents are also raising the same question. How do I support engagement? How do I support engagement and motivation and participation in my student when I don't necessarily understand the online tools? And I can say, as a parent of a kindergartner, I'm overwhelmed with the number of new applications I have to learn. And, I fancy myself as knowing a thing or two about computers, right? And so I think that this is a hard time, and the information that we're getting from everyone, from schools, from students, is the importance of rooting first into our relationships, of taking the time to connect and ask how we're doing, and starting the day and starting the conversations with that trust and that humanity.
What are some of the resources that are available that someone who's listening to this, where can they go? What can they tap into if they notice a child that is struggling, if they notice an adult that is struggling? What types of resources are available?
So first, I want to make sure that folks know about Crisis Connections and 211. 211 can help us with a whole list of resources and assistance, recognizing that sometimes our stress is coming from because we're not sure if we're going to be able to pay our internet bill so that our kids can stay in school next week. And so call 211 or visit, I think it's win211.org, or Crisis Connections, 866-4-CRISIS, 866-4-CRISIS, or crisisconnections.org. Those services will help connect you if you're having a crisis, help talk you through that. There's a texting service available for both youth and for adults. There's a teen link for youth who can reach out and talk to other youth. They'll also help connect you to behavioral health resources, even if you're not in crisis right now, but you recognize that you're starting to feel overwhelmed. And we certainly recommend that people reach out earlier. Our kingcounty.gov/COVID/support has a list of mental health resources, including the link to the Washington Counselors of Color Network, recognizing that being able to the trust and the relationship that you have with your therapist is one of the biggest factors in the effectiveness of therapy. And so good relationship is good medicine, and that's sort of where we need to start.
You are with Juan Cotto and Margaret Cary, who is a child psychologist for the King County Department of Community and Human Services, on your community radio station, our community radio station, Rainier Avenue Radio .world. Margaret, and it's such a heavy topic, it's such a challenging topic, but you said something earlier, and I marvel at the coach of the Seattle Seahawks, Pete Carroll, and just how optimistic he is. And so in our last couple of minutes, as we've had this heavy conversation about such a heavy topic, but how can we infuse that optimism? What are the things that we have to look for? What's the pot of gold at the end of the rainbow for people to look for, to keep their minds free and optimistic as we move forward in this extraordinary circumstance?
Thank you so much for that question, because I think not only is tapping into our optimism, our hope, our plans for the future essential to healing, but it's also essential to what's going to make this a better world. Yes, this is an incredibly hard time, and the disruptions that COVID has caused are also opening up our eyes to innovations and possibilities. And I think we're starting to look into how can we do more online connection, be a behavioral healthcare connection. There's so many more forums that are being stood up right now to support and link people, not only around the region, but across the country and across the world. The racial uprisings that are going right now, may these create a more fair and just and frankly healthy world. And I think as hard and as painful as they are, we have the opportunity in a system that is disrupted to start to really build new and better foundations. I think because so many of us are impacted, frankly, all of us are stressed. I have yet to meet anybody who is not stressed right now for a variety of reasons. Many of us are holding much bigger loads and are disproportionately holding stress, but this means that we're talking more about how we're feeling. And I think that's one of the most key ways to break down stigma is to talk about it. And so I am hopeful that that while it is it is hard, and I'm obviously upset that we are stressed, that the conversations and the ability that we will that are being born out of this time to reach out to each other is going to help us get to know each other better, and to better identify and respond to stress in ways that will promote our lifelong health going forward.
I just want to thank you so much. It's you've made such a heavy topic so healthy and connected to everyone today. This is Margaret Cary, and she's a child psychologist at the King County Department of Community and Human Services. Thank you so much for being here today.
And really thank you for raising this and helping to reduce stigma and support the love that's flowing right now. So thank you so much for your time. And
this is Juan, Cotto, and Margaret Cary on your community radio station, Rainier Avenue Radio.world. Have a great weekend.
Rainier Avenue Radio.